Class of medical students began this week and will receive their white coats on Saturday. It's a traditional ceremony welcoming new doctors into their future profession.
These graduates have an atypical path they plan to take. Health reporter Haley Hernandez is live at U of H with details on how people living in poverty are the targets for these med students. Haley?
That's right. So the University of Houston Medical School mostly started in the middle of a pandemic, and their mission is to serve those in underserved communities, which, as you know, those are the communities that were then hard hit by COVID. Allow me to introduce you to the future doctors who will soon make a difference where our community needs them most. Ileana Oberkirker, Taylor Jackson, and Saeed Maldonado are new med students at U of H. A big deal for these three who come from underserved medical communities and are among the first in their family to go to college.
I never saw any physicians that were African American, nor many female physicians. And so I saw a need, and I knew that I wanted to be the change.
I want to serve in a population that's been historically underserved, and I want to serve in a population that, needs the help the most that they're not getting right now.
Some of what they're not getting is doctors who understand where they come from, look like them, and speak their language.
My brother had a congenital heart disorder that he was born with, and so throughout his life I was a part of his care and helping my mother translate for doctors because she only spoke Spanish. So that for me was my calling.
This class is 60% underrepresented minorities in medicine, 67% female, 53% first generation in college, and 63% low socioeconomic status. And simultaneously, U of H just received a $1 million gift to start a new kind of primary care facility, which won't take insurance, but a membership payment.
This is a model where people pay a modest monthly subscription fee for receiving a broad array of primary care services.
The future of primary care medicine is going to look different. And with the mission U of H has and the eager students, the low income and uninsured can be optimistic about that.
So I love Texas, and I do want to serve this community because I do think we have the biggest need.
So to explain a little more about that monthly membership primary care, you want to think of this kind of like a gym membership where you're going to pay for more direct access to a doctor. This is going to be really appealing for people with chronic conditions who can't afford insurance, but it would not cover you if you needed a hospital visit. I have seen this popping up more and more across Texas, and U of H is hoping to expand their own facilities right here in Houston. Reporting live from U of H, I'm Haley Hernandez, KPRC 2 News.